There you go. So good morning and welcome everybody. For those of you who do not know me, my name is Bhakti Hansodi and I am the Technical Director for COVID-19 Emergency and Critical Care for the JPIGO RISE project. I'm also an Associate Professor in Emergency Medicine and have been overseeing the COVID response in 13 countries. And so a big part of the COVID response has always been that there has been a slew of information, too much information, which has led to misunderstandings of how best to manage COVID patients. So this group of individuals, we thought we'd bring the best from Johns Hopkins University and the best from our colleagues in India. And every 2 weeks, we have featured a new Indian medical institution and their experts to guide us through the evidence behind the management of COVID patients. This is also a new way of collaborating and sharing knowledge. And also, many of you have come from across the country. We welcome your participation here today. So the goal here is not to teach you everything, but to introduce some key topics, bust myths, and be able to convey where the resources are for the evidence-based practice for COVID-19 management. And today we have three amazing experts. From Johns Hopkins University, we'll have David Wu, who's an assistant professor and director of palliative care medicine at Johns Hopkins Bayview. And then from Madras Medical College, we have Dr. Gopal Krishnan and Dr. Rajendran, who are going to be talking us through the realities of palliative care within a busy clinical environment in India. Palliative care is perhaps, I would like to argue, one of the most important topics because the field of palliative care is really providing dignity and considerations in those final moments on the last part of that journey, and to leave our patients without distress, which is ultimately why all of us became providers and healthcare providers at that. So I have a packed agenda with some introductions starting off, and then we're going to have a keynote address by Dr. Tharani Rajan, who is Dean of Madras Medical College and Rajiv Gandhi Government Hospital. We'll have a case presentation from our Indian experts to really tell us about the realities of this on the ground, and an evidence-based review from Dr. Wu. In the middle, we're going to have a panel discussion because a lot of questions are just difficult to capture in a formal presentation. We want to make this interactive. So I'm going to ask all of the participants today to use the chat as well as you possibly can and ask us any questions you want because all the experts will be there answering them in real time. So I'm going to start off with the welcome addresses. First of all, I want to set the stage for today's talk. Today's talk is about reviewing the palliative care considerations specific for COVID-19 and really discussing the timing and pathways to incorporate palliative care specialists into the management of COVID-19 patients. Who are you? Our audience today is from around India. We have participation from 23 different states, with the highest participation from Tamil Nadu. Many of you today that are registered are clinicians. There's 188 participants that are already registered with 126 physicians. And what I would like you to do is if you're on WhatsApp or if you're on social media or Twitter or Facebook, go ahead, tweet out the registration link, send it to your colleagues. While a recording of these lectures is available, it is much more meaningful to engage in the discussion in real time. And this activity today is brought to you by JPIGO India. So JPIGO India is not just this RISE project. JPIGO India has a team of 500 individuals working across the whole health sector to build capacity in India, led by our strategic advisor, Dr. Bulbul Sood, and our country director, Dr. Sumesh Kumar. And many of you, especially the deans and the directors of the medical colleges and IAS state leads, you'll know Dr. Vineet Srivastava, who is our chief of party, who is leading this multifaceted, complex project across the country. And none of this would be possible without the vision, the direction, the support and championship from our colleagues here at USAID. And it's worth mentioning Dr. Sangeeta Patel, Dr. Amish Shah, Cynthia Gear, who's going to say a couple of words, and our agreements officer, Vijay Paul. They are not only championing the funds coming to the US, but they're building the networks, helping us decide upon the strategic direction and helping really shape how this work is amplified and leads to long-term capacity building, not only at the health facility level, but at the national and state level. So Cynthia, can I invite you to say a couple of words?
Sure. Thank you, Bhakti, and good evening, everyone. On behalf of the United States for International Development, USAID, I would like to congratulate the Madras Medical College and NHM Tamil Nadu on your efforts to mitigate the COVID-19 pandemic in Tamil Nadu. At the outset, we at USAID would like to share our gratitude to the Dean of the Madras Medical College, faculty members of the Madras Medical College, and attendees of NHM Tamil Nadu for collaborating for this capacity building intervention. We'd like to also thank Johns Hopkins University, Johns Hopkins India Institute, and Madras Medical College for collaborating with the USAID supported RISE program, which Bhakti just mentioned, implemented by JPIGO, to initiate these clinical case series that brings together clinical experts from the United States and India to share their knowledge and experience on relevant topics of COVID-19 to COVID-19 critical care providers across the country. And USAID is proud to be supporting this initiative, and I'm very honored to be with you this evening. USAID's COVID-19 collaboration builds on more than 70 years of partnership and cooperation in health. To mitigate the challenges posed by the COVID-19 pandemic, USAID is working closely with the Government of India, state governments, and our partners to provide life-saving care and treatment, deliver public health messages and safety precautions to local communities, strengthen case finding and surveillance, build the capacity of critical healthcare workers, and mobilize innovative financing solutions to bolster emergency preparedness, response, and recovery. Throughout this pandemic, USAID has continued to support vital initiatives that address maternal, child, and adolescent health, TB, and HIV, and strengthen the healthcare system for improved access to quality services. The unprecedented surge in cases during the second wave of COVID-19 highlighted the need for healthcare workers and nursing staff who are well-trained in critical care management and able to treat patients who require a high level of hospital care more efficiently and more effectively. Through this RISE project, we have been working closely with various institutions that are centers of excellence or hubs that can build the critical care management capacity of several COVID-19 care facilities. And these are the spoke facilities, so that healthcare providers across these intervention states have the skills and information needed to treat the most critically ill COVID-19 patients. So this fortnightly RISE JHU case discussion series is a part of our continuous capacity building efforts on critical care and COVID-19 management. And as Bhakti mentioned, today is the 6th event in the series. So we believe that such events are going to go a long way in addressing the capacity building needs of so many providers and also promote knowledge sharing as the pandemic further evolves. So again, I'd like to welcome all the participants who are attending today's session on palliative care, considerations in COVID-19 management, and also share our appreciation to the expert facilitators of today's session. Thank you very much, and back to you, Dr. Bhakti.
Thank you so much, Cynthia. And to mention that the case series is just a tip of the iceberg. Many of the hubs are executing 4 to 5 day training programs for nurses and physicians. We're supporting laboratory capacity, surge preparedness, and the oxygen ecosystem. So to find out more, contact any of our RISE team, put something on the chat, or reach out to Dr. Vineet Srivastava. So in the background here at Johns Hopkins University, and I'm almost done with intros, I just want to mention 3 colleagues. Dr. Wu will be your expert today. Dr. Souvik Chatterjee, who is Assistant Professor in Medicine and Director of the Intensive Care Unit at Johns Hopkins Bayview Medical Center, will be your facilitator, will be guiding us through the remainder of this presentation. And my 2 colleagues, Dr. Pavna Seth and Dr. Valeria Sula, who in the background are collating all the resources and putting together a comprehensive resource guide, which will be shared with all participants. So without further ado, I want to introduce Dr. Tharani Rajan, who is the Dean of Madras Medical College at Rajiv Gandhi Government Hospital. He'll be providing us with the keynote address today, and also has a couple of slides I believe he would like to share. So Dean, sir, I will be your button pusher, but I'll hand over to you.
Greetings from Madras Medical College. A few highlights about our institute. This is one of the largest medical college hospitals of Asia. It's a government-funded medical institution. There are 14 affiliated institutions attached to medical college. 6,200 inpatient beds are available. 45 departments are existing in our institute. There are 2,650 undergraduate, postgraduate, super specialty medical students are undergoing courses in our institute, along with 1,000 paramedical students. An average of 15,000 to 17,000 outpatients we have seen pre-COVID time. During the peak of second wave and first wave, we have designated exclusive COVID ward in a tower block 3 with 7 floors, which is the largest COVID care hospital of the state of Tamil Nadu, where we provided comprehensive COVID care with totally free of cost. There are 2,050 total beds exclusively designated for COVID patients, out of which 1,522 are oxygenated beds, in which 600 ICU beds are available. So far, we have treated 57,000 COVID patients with a cure rate of 96.4%. The first floor, we have a dedicated 10 hemodialysis unit. Patients who come with COVID positive were managed there. In addition, we also have in outpatient department exclusive CT scan facilities, lab facilities. So far, RT-PCR test, 1.6 million have been done in our institute. Exclusive biochemistry and pathology laboratory also available in our outpatient department. The photograph which shows a happy moment. Patient was with us for more than 120 days with multiple issues. He took photograph with our COVID care team. There was a felt need for zero delay. Patients during the peak of first wave as well as the second wave received with severe distress and sick patients, and also we had received walking hypoxia patients. To avoid that, we had started a zero delay ward with the 20 beds. Gradually, we escalated to 70 beds during the peak time. After starting this zero delay ward, there was a significant reduction in mortality and morbidity. In the zero delay ward, where we provided a level 3 care, high flow nasal oxygen, CPAP, even intubation also was done. All the therapy were started in the initial zero delay phase itself. After that, they were shifted to the ICU beds and respective places. This was published in the international journal as well. The other COVID care strategies which we followed is a multidisciplinary approach where we involve cardiology department, nephrology department, neurology, surgical team. As a multidisciplinary approach, we manage the COVID patients. And with the senior faculties, daily audit review was conducted. Their inputs were very useful. They found there were early morning deaths due to hypoglycemia and dyslipidemia. So what we did, we formed a dedicated team to manage a dysglycemia as well as dyslipidemia. So in our COVID management, we had a 4-tier approach. The first line medical officer, facility in charge, middle level consultant, treatment in charge, and the senior consultant were involved in managing the patients. There were issues in the feeding in the sick wards. So what we did, we appointed designated feeding nurses to manage these patients, to feed the patients. As well as we also started psychiatric counseling in the form of audio as well as video counseling were given by the psychiatric team. So we also formed a team led by a professor of anesthesia along with technicians. They were closely monitoring the oxygen therapy. Few incidents had happened. Some of them, patients who went to toilet were unconscious. Also, they found with a low oxygen saturation. So what we did, we kept an oxygen cylinder before the restroom. They took oxygen, pre-oxygenated, And then after coming back from restroom, again they took oxygen. Then after that, there was no such incident happen. In addition, we also had regular web lectures to encourage our junior medical consultant as well as the middle level consultant. Regular classes were conducted for all the paramedics as well as the medical personnel. So during the peak time, we had received nearly 247 ambulances in a day. The picture which shows the ambulance, how it was lined up in front of our hospital. There are few incidents also had happened, few deaths had happened. So immediately we constitute a triaging team consisting of medical officer along with the paramedical staff. They immediately went into the ambulances. They assessed the patient. Sick patients were immediately shifted to zero delay and treatment was started in the ambulance itself. Oxygen were provided. So after that, such instances totally stopped. So following the first wave, we had started post-COVID follow-up clinic. It was the first in the country under one roof, internal medicine, diabetology team, cardiology team, psychiatrist, plus dietitian. They screened post-COVID follow-up patients. Nearly 1,400 patients were screened. Next one. See, the challenges are not ended with COVID. Following the COVID, we also had an outbreak of mucormycosis. Huge number of patients turned to our hospital. Nearly 1,070 patients across the state were received. And under one roof, we formulated again ENT surgeon, ophthalmologist, psychiatrist, and diabetologist. We screened the patient in the early phase itself, and the surgical intervention was given for more than 1,000 patients.
Thank you so much. I have to say,
with me, I have Dr. Gopalakrishnan, nephrology director, and Dr. Rajendran, associate professor of internal medicine, going to present about the palliative care and the challenges in COVID. Thank you.
Thank you so much. The state of Tamil Nadu is truly very lucky to have Madras Medical College at the helm of its care. And